Hello, welcome to our first webinar on healthcare, primarily on the changing landscape of healthcare, how to engage today's healthcare consumer. I want to welcome everybody who's joined us today this morning for the session, and I also want to welcome Dr. Jessica Gruendler. Dr. Jessica has over 35 years of nursing experience, having worked for over 10 years in the corporate world with software companies to provide direction in system design, optimization, and increasing sales. In her role as the Director of Surgical Services, she has worked with hospital sales teams, the C suite, and the physician teams to develop service lines and increase volumes and patient access to care. I'm looking forward to having a collaborative conversation with her today. Uh, my name is Nick. My full name is Nikhil Parwal. I'm one of the regional sales managers at Lead Squared, and I help in growing our footprint in the healthcare industry for North America. A couple of quick housekeeping things before we get started. Just to avoid any distractions or background noise, we're going to keep all the attendees on mute. This means that you don't have to worry about policing your pets or your little ones who are running around the house if you're working from home. If you're having any issues with the volume, try clicking on the setting wheel to either change your audio device or to adjust the volume. We are hoping to pique your interest and conjure some ideas, so there will be a Q&A at the end of the webinar. Please feel free to use the chat function to ask your questions. We will try to get to as many as we can. We will also follow up after the webinar with any that we are not able to answer in our session today. So don't worry. And with that, let's get started. I'll turn it over to Dr. Jessica.
Hello. For today's objectives, we are going to cover the modern healthcare trends and how they have shifted from traditional models. We'll talk about the new healthcare consumer profile, marketing strategies to attract and engage with today's healthcare consumers, and then we're going to collaborate with participant feedback, sharing ideas. The needs of and expectations of today's healthcare consumers have changed. The advancement of technology and personalized digital experiences have truly infiltrated virtually every aspect of the consumer's lives and risen as the expected norm for any interactions and many interactions. With healthcare, that is no exception. This evolution brings tremendous opportunities for healthcare providers and organizations to engage with new and existing patients. But it's not without its challenges, and we're going to help you work through those challenges today. We're going to look at the shift in patient engagement in healthcare and how your team can provide better patient experiences. The new healthcare consumer. The consumer healthcare industry has seen significant growth in the recent years, attributed to two main factors. The self-care movement, coupled with rising healthcare costs. Consumers continue to seek more value for their money and want to take proactive control of their health. Start thinking about strategies in your business for both active and passive income streams. According to Nielsen IQ, 40% of global consumers say that they make proactive and wellness choices on a regular basis. With their growing consumer interest in their own health, there has been a rise in dietary supplements, wearables, wellness products to support mind, body, and overall health. A holistic approach to wellness for consumers today is really attributed to the pandemic's lasting impact because individuals across the globe struggle to adjust to the new normal. From international lockdowns to changing hybrid work environments, most nations are still experiencing effects of the pandemic. And those can be positive to companies who are working towards the goals of meeting the needs of those consumers. As tech adoption has grown across generations, wearables, tracking devices continue to rise in popularity. These devices provide consumers with ways to own and track their health, their medication intake, their exercise, and their wellness. As we look to the future, we could see a greater emphasis on biometric data tracking or even over the counter products ordering through digital means rather than in person consultations. At the time, consumers expect transparency from the companies that they deal with, and how their data is used and managed through devices is extremely important to them. Consumer healthcare companies will need to continue to monitor HIPAA, CCPA, and data privacy laws to ensure their use and transmission of data falls within accepted regulations. While taking a deeper look into their own health and well-being, consumers seek transparency from companies through their brand, their product marketing, and through actions that promote well-being for the world around them. As consumers continue to seek convenient and fast digital alternatives, brands are forced to increase their online engagement and connected to end-to-end experience strategies. Nick, what is one of the ways Lead Squared can be part of a strategy to improve online engagement with customers?
That's a great question, Dr. Jessica. I think one of the key ways is to identify how we can be in touch with our patients or our prospective customers, not only through just one single channel, which traditionally used to be either you meet them in person or you talk to them on the phone. And now that we're moving towards a more digitized operations, there are so many different touch points like emails, texting, WhatsApp. You want to be able to connect it with them on social media. So one of the things that Lead Square does offer is being able to communicate with your patients across all of these different channels, identifying and analyzing how many different ways are the patients connected to you. And then obviously being able to build a score that tells you how out of a pool of, let's say, 100 different prospects, who are the ones which are most engaged with you at different channels. That so the one of the things that Lead Square does is helps you build that engagement score that tells you that, okay, out of these 100, these are your 25 most engaged patients that have a possibility to get come up and sign up with for your services. So the engagement score becomes very, very important in identifying that level of engagement for anybody.
That's critical, Nick, and thank you for your feedback. The customers and the prospects that I've worked with you on, that's one of the leading satisfiers in your product. So thank you for taking the time to explain that. So now we're
Absolutely.
going to take a look at today's healthcare consumer models. Healthcare futurists believe that by 2040, most care will be delivered at home and in outpatient settings or virtually. Younger consumers are not satisfied with the healthcare status quo, and consumers of all generations are more willing to try non-traditional resources. Non-traditional healthcare, such as virtual care, retail walk-in clinics, and other digital sites are gaining in popularity. COVID-19 has drastically changed how adults interact in the US healthcare system, as well as what adults expect from their healthcare brands. The pandemic has expedited certain trends within the healthcare space, such as the use of virtual care tools for primary care, has improved, and it has dramatically improved the access to not only mental health and wellness, but also weight loss, fitness, and self-care programs. The industry must adapt to long-term shifts in this customer behavior, including the expectations of personal health, data safety, and the need for honest and transparent communication. Digital health management has gained momentum with customers, and tailored interactions are viewed as the most credible. Healthcare brands must adapt to shifting consumer needs. Virtual care has a place in medical communication strategies. There is the great potential to build trust in the US healthcare system. Americans are only right now cautiously trusting of the healthcare system. And your organization can combat this mistrust by emphasizing respect and empathy, and gaining customer trust requires a multi-pronged approach. Now we're going to take a look at the key marketing takeaways for today's consumer. Organizations need to assess their current barriers to consumer satisfaction and deploy analytics and patient-centric technologies to improve convenience for their consumers. In addition to convenience, consumers are looking for speed and transparency. For example, when a West Coast health system adopted a precision scheduling tool, it allowed them to minimize wasted time and increase their imaging exams to open up 5,000 new slots annually, which not only increased patient satisfaction at the speed at which they could be seen, but also, of course, increased their customer touch and revenue. While patients want the ease of digital interactions, personalized care is the touchstone of their loyalty. According to a 2020 survey of healthcare consumers, the ideal healthcare experience requires a personal touch. Whether you're virtual or digital, that personal touch is essential for all these encounters. Patients say it's paramount that clinicians take time to listen, show they care, and communicate clearly. These improvement efforts have to have teeth, and they must be associated with programs that drive measurable outcomes. Some of the other potential that you have is in membership services. Membership services merge physical and digital approaches and increase continual engagement in programs such as mental health, weight loss, and self-care. So let's take a look at customer engagement across generations. The graph to your right shows you the different generations, and we're going to talk for a short period of time about how your interactions with those different generations is significantly different, and it will improve your outcomes with marketing and touching those patients. Companies must understand the unique value of each of these generations of patients, as patients may choose their healthcare providers for many different reasons based on their age or generation. This includes marketing tactics to engage consumers for different generations. For example, the Medicare population has been called the greatest generation and the silent generation. They choose care primarily on physicians' suggestions or prior experience, while baby boomers research their options more frequently. Generation X, or patients aged 30 to 45, consider healthcare brands and shop for healthcare. And Generation Y, or patients 20 to 30, are influenced by advertising, reputation, and patient experiences. Healthcare leaders should understand the unique values of each generation of patients, as patients choose their providers for many different reasons, as we've covered, based on their age. There's a report that's been put out by Smith & Jones called The Understanding of Healthcare Consumers. And this report shares 4 key marketing tactics, which often are effective in engaging consumers. Those are physician referral initiatives, because baby boomers, as we talked about, rely on physicians, and marketing to those referring physicians, because you will be supported by reputation with them and positive patient experiences, and that will attract Generation X and Generation Y patients. The customer experience, communicating patient experience by having reviews posted or getting referrals from former patients, is effective in attracting patients 65 years and older. Baby boomers respond to this patient experience communication also, not only as patients, but caregivers for the older generation, which would be their parents that they're taking primarily care of. Generation X values past experiences and uses social networks to inform their decision. Reputation, building, and management. Reputation and referrals, particularly when supported by integrated branding and marketing, communications can affect a senior's choice of care provider. Generation X relates to healthcare brands and responds to brand messages and positive patient referral, where baby boomers consider reputation when they choose to seek care. Generation Y responds to healthcare brands and very creative advertising. There's an integrated online and offline messaging that drives information to the web. To do that, Nick, would you talk about how Lead Squared can provide data for determining a strategic marketing strategy when your focused message is either email, LinkedIn, Twitter, Instagram, or Google Ads?
For sure. So one of the things that is our core competency as a platform is the ability to sit right at the source and identify where anybody is reaching out for help, whether they're coming through organic search through your website and doing a form fill, are they just reaching out to you via email? How do we make sure across all of these different channels, including Facebook ads and Google ads, that's where a lot of now the marketing dollars are being spent by organizations to capture the attention of anybody who's out there looking for services, being able to capture that in real time and then build a journey for that kind of a patient experience where if I find somebody, if I get a lead that says that they found my services through a Facebook ad, I want to be able to communicate to them in that manner which is more responsive to the type of customer that I'm talking to, which is coming from a Facebook ad platform. Similarly, I can build customized journeys for each of these different focus messaging. And at the end of the day, being able to analyze how my conversions are for each of these different sources, where am I getting most attraction from, right? Am I getting most of my consumers coming in from Facebook ads? Or am I getting them through LinkedIn or through a Google ad campaign? Being able to analyze that data through our reports that we have built in as templates becomes very, very essential for organizations to be able to analyze their overall success and operations.
That's great, Nick. And that focused messaging and your consumer engagement is what we're going to talk about next in setting your goals. So what are your goals for moving your company forward? There's multiple goals and there's multiple ways to address those. And we're going to have some polling questions later on to get some ideas and further discuss what your individual needs are. So one of your goals could be customer retention. And you do that by staying connected for future needs of the customers, referral from those consumers, and reviews and testimonials. So as we discussed previously, depending on the generation and the age of the people that you're marketing to or think your consumer base is, you will have a different strategy for this customer retention. You may have a great customer base and want to improve patient satisfaction with one of the tools that Nick explained earlier on how you can measure your consumer engagement. You might want to increase or expand your patient volume. You'll need to know where those patients are coming from and what the most effective way is to market to them, either from a past marketing campaign or a new marketing campaign that you're rolling out. Do you have a digital platform for your patients or for clinicians? The Lead Squared offers really three different solutions to a platform that we're going to look at in just a minute. Or is your goal to improve profits, whether it's by some other way than customer engagement or customer retention? There's many ways to actively and passively engage your customers strategically to improve your profits. And then there's data, multiple kinds of data that you can pull from Lead Squared to understand how to set those strategic goals and to evaluate how they're working for you. And then a lot of organizations we've talked to go to live community events to interact with their patients. So is that one of the things that you want to do to approach increasing your market share. So let's take a look first at what are your data goals. So can all of you look at the poll? The answers to what are your data goals can be stay connected for future needs, referrals, or reviews and testimonials. Please submit your vote. We'll give everybody a minute here and then we'll move on to the next goal. Nick, do you want to take a minute to discuss how Lead Squared will facilitate your company reaching its goals?
Oh yeah, absolutely. I think one of the important factors that Lead Square helps add value to the operations for any organization is identifying from the start how can we make sure that we are not losing out on any of these prospective patients that are coming to us, right? How do we make sure that every single patient inquiry is touched on? So we help through the engagement score that we discussed earlier and having multiple touch points of engagement. We make sure that every single patient is being reached out to. You have a cadence that you have built out to make sure that they're either being touched by phone calls, through emails, through text messages, through a social media campaign. They're engaged at different point in times. Two, how can we make sure that the onboarding or the intake process is automated to a large extent? This in turn gives a lot of the actual team members in the organization a lot of time to actually spend talking to patients and talking to them about the services that they need instead of them having to spend time in front of a technology platform. So we let automation take care of a lot of those things. And in the end of the day, a lot of this eventually helps in becoming a more efficient and a more productive service overall. A practice that can focus more on actually doing their interactions with patients and providing them service, and letting the platform itself take care of a lot of the productivity tasks and the efficiency of everybody who's working internally.
That's great. And all of these data goals are important in not only your retention, but expanding your business. Let's go to the second poll question. What are your customer retention goals? Are you looking at demographics so you know where to focus your campaign? Are you looking at who the payers are or whether they're cash pays? Or do you want to retain those customers to provide referral activities and reviews for you? So Nick, while we're waiting for people to answer this this poll, why don't you talk about a little bit about how HIPAA compliance works with the demographics of the patients to protect their data?
Absolutely. One, I think from a being able to data security is absolutely important, right? And being a HIPAA compliant platform ourselves, we take that with utmost importance. So we make sure that we always recommend our customers not to either share or transfer any kind of PHI information in any kind of marketing collaterals or marketing communication, right? So we make sure that is mentioned even to the patients when they receive that email, that you only send it in a secure manner. Either you're doing that through a dedicated portal where you have access to that portal, or you're doing it in one-on-one in an encrypted messaging. The other way, obviously, also from a HIPAA compliance standpoint, is we make sure each of our clients' data is hosted in a secure HIPAA server without them having to share that with any other client. So it's a dedicated instance that we make sure is for that specific client. And it does not matter whether you are a small clinic with just 2 members or it's a hospital system with over 200 people in the organization. So everybody gets their own dedicated instance because again, we want to make sure that patient information and patient PHI information is absolutely secure.
And that transparency and privacy are what most consumers are really looking for these days.
Absolutely.
So, where is your focus as an organization? What I've learned about Lead Squared is essentially their single platform offers you, sorry about that, offers you three solutions. So, the three solutions that you actually can use in the Lead Squared single platform are a CRM for a referral base or marketing. You also can use that for your current patient population to document some clinical aspects of care, moving your patients forward in your care process, and also to capture leads from future patients. And it also gives you the knowledge, as Nick has explained, about how to find out how patients or consumers find out about your services. Is it through the multiple social media platforms that we covered? Is it community events? Depending on the generation, it could be family and friends. If you're using Google Ads, is it from you just direct to your website? Are you getting primary care provider referrals, or are you partnering up with your local hospitals, ER, and urgent care facilities? So think about who your consumers are and what solutions that you would utilize to push forward your strategic marketing plan. Do you need to capture clinical data to move your consumers through the process? Or are you capturing leads? Or are you doing effective marketing? And are you utilizing Lead Squared to its full potential? So this leads us to poll number 3. Which is most important to you for your CRM? Are you looking to increase your referral base and utilize it to answer questions about marketing? Are you using it for your patient population to document demographics or some type of clinical assessment information? Or are you capturing future leads? I'm going to answer a basic question here, and we're going to move forward. Nick has already talked about the importance of a HIPAA compliant tool to use with your customer base. And so now I think we might be moving on to discuss some of the poll results or answer any questions that have come up in the chat. So when we look at the polls, it looks like when we're talking about which use is the most important for your CRM, most people are using their CRM currently for capturing future patient leads. What are your customer retention goals? Referral activity is the leading answer for customer retention tools. What are your data goals? The data goals for the people on this call is referrals. So, Nick, what are your thoughts about some of those responses? And for those who are using their CRM to capture future patients or leads, how do you think that they could use that for their patient population for demographics and assessment documentation?
For sure. I think I want to start with the third poll that we did, which is what is the most useful mechanism for using a CRM platform. And like the poll says that it's for capturing future patient leads. I think it ties back to what you mentioned in the start of your presentation was nowadays that it's so competitive that people are not only going by just what my physician says. I want to be able to see multiple areas of touch points and then analyze who is the best service provider for me. So the right now, I think most people are they have so much of option, they have so many choices to choose from. Being able to identify that future patient and keeping them engaged is becoming one of the more bigger use cases for organizations in healthcare to have a CRM and have those capabilities.
Okay, and customer retention goals. The highest score for customer retention poll goals in our poll is referral activity at 46%.
I think that's a very common use case, right? And I think that ties back to the first poll that we did, which was what are some of the data goals, and we see that referrals is one of the most common answers. I think being able to, while social media marketing are becoming more and more important, I think one of the key things is also to make sure that we keep our referral sources engaged. How do we make sure that the physician clinics, how do we make sure the payers, how do we make sure the health plans, everybody that we're communicating with in the community or in the neighborhood that we're dealing with, how do we make sure that those referral sources continue to know about the good service that we are providing, and the patients that they have sent us can be provided service in the right manner, in the right time, without having to go through the cracks. So I think that being able to engage to and manage those referral sources is one of the
Mhm.
key areas that we can help with within Lead Squad as well.
Awesome. We have a question in the chat, Nick, that I know you can answer because I've heard you answer it before. What are you able to integrate with EHR systems?
Absolutely. Thank you so much for that question. Yes, we have a very robust platform that has the ability to integrate with EHR systems, whether they are integrations are happening through APIs. So we have enterprise REST APIs, or we can also integrate it through HL7 messaging. So we have both those capabilities internally. And I want to take this opportunity to also mention that just yesterday, we announced our partnership with Advanced MD, which is one of the leading EHR platforms in the United States. And similarly, with a lot of other platforms that we've integrated with in the past. So being able to identify different processes, right? At what stage do you want to push that data from the CRM into the EHR? Or at what time do you want to bring some information back from the EHR into the CRM to trigger some of those automated tasks and activities, is one of the key functionalities where we identify that integration and are able to successfully go ahead with that as well.
So, Nick, I hear you saying that you offer bidirectional interfaces to multiple EMRs. Are you comfortable telling us some of the EHRs that you actually have developed those interfaces for?
Absolutely. We've done those integrations with EHRs like Dr. Kronos, Kipu, Cario. We've integrated with advanced data systems, which was through HL7. We built the bidirectional interface. We are currently in the process of also doing our integrations with Athena, and we're testing with a whole, couple of different other platforms like Open Dental, Epic, Centricity. So we're also testing and making sure that we can offer that to our clients in the future as well.
That's awesome. If there's any other EMR or EHR systems out there that you have questions about, put them in the chat, and Nick can follow up with you on that.
Absolutely.
Is there any other questions in the chat? Okay, great. We've covered a lot of information over the last 30 minutes. We've given you some information from the polls and some things to think about on not only how you can market your business and expand your business. Nick, do you have anything to finish this out with?
No, lastly, the only thing I would want to say is thank you to everybody for taking the time and joining us today. Special thank you to you, Dr. Jessica, for sharing your experience, your expertise, and your insights with us. We'll definitely follow up with everybody and hope to have the opportunity to offer a more detailed glimpse or insights into our own sales and marketing automation platform. So feel free to reach out to us if you need more information. I'll be happy to help. Until then, be well and stay safe.
All right. Thank you, everybody. Please don't hesitate to send questions to the sales@leadsquare.com, and Nick will get right back to you. Thank you.
Thank you very much.